here comes the President of the United States.
President John F. Kennedy visited San Diego just 5 months before his 1963 assassination.
He's waving to all of the people along, waving to our camera right now.
A photograph captures his motorcade passing by the 24-hour Rutford's restaurant. The community staple has welcomed diners at all hours since that day, but that streak ended in March. Governor Gavin Newsom closed all on-site dining to curb the spread of coronavirus.
We let go of 40 people. That was hard to do.
Rutford's owner, Jeff Kasha, was forced to only offer takeout. Kasha has since been stuck in a cycle of reopenings and threatened closings based on the up and down of local coronavirus cases.
We put in dividers, we have masks, we have gloves, everything's sanitized.
Across California, activities like dining in a restaurant or practicing your faith are controlled by coronavirus numbers. KPBS examined the data that's driving decisions in San Diego and found it's riddled with complexities and caveats.
I wouldn't say I'm confident down to the last decimal point.
Dr. Bill Schaffner is the medical director of the National Foundation for Infectious Diseases. He says these systems can be imperfect.
But pretty close, and close enough to make reasonable decisions and to assess trends over time.
In a series of stories, KPBS is exploring this data-driven system in San Diego to uncover the challenges and how they're overcome. And that system sort of begins with snot.
You're going to go about to the mid-level of your nose.
Nurse Darcy LeRae walks me through how to shove a swab up my nostril.
You're going to rotate it several times around the wall of your nose.
Lab machines will examine the secretion for the SARS-CoV-2 virus. That's what causes COVID-19.
You might cough or sneeze.
My results were negative, but thousands of snot-covered swabs from the noses of San Diegans are transported daily to labs. At Helix Lab in La Jolla, the hours-long process to get test results begins with a robot named Boots.
Booties.
Actually, he thinks he's Booties. That double O gives him problems. But the results he and his machine friends uncover are relayed back to local and state decision makers through a complex and sometimes overlapping reporting network. And it gets a bit wonky, so stick with me. Helix only handles local swabs collected at county testing sites, so Vice President Mark Laurent says they share results with San Diego officials twice.
One way is we actually send it back to the operations team that's going to contact the patient.
And then to the team that tracks the data that controls reopenings, that's sent by fax.
It's ancient, but it's also one of the most safe way to pass HIPAA information along.
And they send it to a state team in Sacramento. So labs report both to the state and to the county. But some commercial labs report only to the state, which automatically passes San Diego results on to the county. And labs report to the healthcare providers that sent them the tests so they can tell patients. Providers also report confirmed cases to the county. The county's public health team wouldn't agree to an interview, but said in an email that staff checks daily results against its database. If they find a new result is actually a duplicate, it's attached to the existing record. But the county says some may slip through. Still, San Diego and Sacramento don't always agree on the numbers that may trigger closings. Their calculations didn't match for a bit. Thousands of results were lost in a statewide glitch. And most recently, elected county officials, including Supervisor Greg Cox, wanted the state to ignore positives among San Diego State University students.
Seriously consider discounting or not including the approximately 700 cases that we have right now from SDSU students?
The governor disagreed.
So the answer is no.
That looming closure was avoided because the case rate, even with SDSU positives, was below a state threshold. But the back and forth has left Rutford's owner, Kasha, on edge.
We ran out of PPP money. We're into our savings. We've overspent.
He worries he can't survive another closure, but the case rate is only announced on Tuesdays, so businesses wait every week to learn if the data is going in the wrong direction. And this past week, San Diego again narrowly avoided a case rate the governor considers too high. Tarryn, Mento, KPBS News.